The breast cancer community is growing, and pink awareness is everywhere during October. What is the role that you see, or the place of the young woman with metastatic breast cancer in the overall breast cancer community?
The issue with pink is much the issue with the term survivor. And some young women with metastatic disease are offended by the word survivor since it excludes them. And others embrace it, and people the same with the pink. What we need to do, and perhaps what the role of our organizations and the young women themselves, our young advocate community at Living Beyond Breast Cancer, is to educate and to include women with metastatic disease in October, in the celebrations, by understanding what metastatic disease is, and break through that isolation, include them in the conversations, and that will go a long way.
The population of young women with metastatic breast cancer may be small, but they're powerful and they have very strong voices. And I think the role of our organization is to make those voices heard, especially during October when there's so much pink and all this going on. So,
I'm not a fan of pink. I wasn't a fan before I was diagnosed, but I think that that Pinktober, on a lot of levels has almost become a farce, and it's kind of hides the truth behind all the pinkness. And I think our role, as patients, as doctors, and everything is to break through and show people the reality of cancer, what can happen, where you can get to, and the fact that you can still live with metastatic breast cancer, and that it's not all pink, but it's not all terrible, and that we need more research and more education, and we just need to keep talking.
I'm actually, to some extent, a fan of the pink. I feel like, we in the breast cancer community have really benefited from the identification of pink with our disease. And I think there are lots of other cancers that wish they had a color as bright as ours, and could get as much attention as we do in October. So I'm happy to ride the wave of pink during October. I'm happy to see the football players wearing their pink sweatbands and their pink shoelaces, because I know that there are millions of people who are watching and learning about breast cancer. But I do agree with the panelists, and particularly what Seporah just said about sort of digging deeper into the pink. I think the overall pink washing of the disease definitely has its benefits to us, but we could do a better job as advocates and as patients, sort of digging deeper and sharing more impactful messages about what it really means to live with breast cancer.
I have never been a fan of the pink, but a number of years ago I was doing a project on metastatic breast cancer and interviewing women with metastatic breast cancer, and there was one woman who said she loved wearing her pink ribbon because it opened a conversation, and that was people were not talking about metastatic breast cancer, but people would see her ribbon and they would ask her questions. They would assume that she was very open about either being a breast cancer survivor or living with breast cancer. And so I think one of the things that's very important, and Catherine said it before, is that we can't. Everybody has their own approach to how they want to live their lives with whatever cancer diagnosis they have. If they want to call themselves a survivor, if they have a different word that they want to use. Some people just object to that very much. Some people really dislike pink. I don't like pink, but I think that it's very important, and one of the things one of the best things I've learned through this, through being in this community, is to not judge people for their personal choices about the way that they want to live with their disease. And so I think that's a really, really critical point.
But the pink has evolved. I mean, for those of us who've been around a long time watching this evolution of the pink ribbon, years ago, patients would get pink teddy bears and they would infantilize the disease that clearly was inappropriate. But what it did accomplish was it did get people communicating, and you folks have the opportunity to direct that communication. And now, what you see now is much more directed at fact and reality and importance of community. So I think it obviously cuts both ways, but I think it's been advantageous overall.